And welcome back to Body Beautiful. I'm Janelle Marie. I'm here with Dr. Joseph Mele. We are talking everything about plastic surgery. We're also going to be taking your calls on the air. The number 415-561-8753, and we will give you Dr. Mele's number later. So of course, be ready to take that down as well. All right, let's go right to a phone call, doctor. We have Monique from San Francisco. Monique, are you there?
Yes.
Hi, Monique.
Hi, Monique.
You've got a tummy tuck problem, or you want to ask a tummy tuck question?
Yeah, because I've had 4 C-sections.
Oh.
And so I want to know if that is a patient with that many C-sections, are they at high risk for a tummy tuck? I'm really scared.
No higher risk. C-section surgery, usually there's a scar down low, but even when there's a vertical C-section scar, all the skin below the belly button is removed, usually with the tummy tuck. So those scars from the previous surgeries are removed also. The C-section is repaired, the muscle's repaired underneath the skin, and when we do tummy tucks, we really don't get to that area at all. All I need to do is release the skin from the overlying scar that's down deeper. So it doesn't put you at higher risk.
Does that sound good?
C-section, would we have to be put under the, or can we do it under the epidural like they would do for a C-section?
For a tummy tuck, usually it's done under anesthesia. There's some things that we need to do in terms of relaxing muscles, which you wouldn't do so much with a C-section. They're just safer to do under anesthesia. And I want people to have not only nice results, but nice experiences. And trying to muscle through a tummy tuck under local doesn't sound like fun.
So, Monique, are you doing the mommy makeover?
I would love to. I would really love to. I think I deserve it after 4 C-sections.
You do. You do.
I was going to say,
absolutely.
after 4 C-sections.
All right.
A lot of work.
Does that answer your question? Any other questions for the doc? You're good? Okay, Monique is good. Good job. That was a tough question. 4 C-sections, that's a lot. So let's talk breast reductions, shall we? We're going to talk about breast reductions in men a little later as well. So men, you can call in also. But let's talk breast reduction in women. Tell me what goes on in that.
So normally with breast reduction, we're doing it because of either just the breasts are too large, they're in the way, out of proportion, or there's symptoms. Like the caller who called in earlier is having neck pain, back pain. Sometimes they'll get shoulder rutting or actual dents in the shoulders from the bra straps, rashes underneath the breasts, especially in the East Bay when it gets hot in the summer. When the skin's folding over, it just doesn't breathe very well. So there's a lot of reasons why we do the breast reduction. It's an outpatient procedure. People go home the same day. Unless someone has a really large reduction, sometimes I will keep them overnight. But the idea is to get rid of that extra weight, and at the same time we do a lift to help with the shape of the breast.
And so somebody can also put an implant in, right? If they do a lift, maybe they need a little volume because they're No,
it sounds totally weird to do a breast reduction with an implant. Because implants add volume. But occasionally the shape of the breast is such that it's very, very flat up top. Even though there's a lot of breast tissue down lower. And the nipple, again, we don't take it off. We leave it with the breast tissue, which also means the breast tissue stays with the nipple, which is on the lower part of the breast. So occasionally, to get a little bit of fullness in that upper pole, I'll use a smaller implant, usually a wider, flatter implant that'll fill that upper pole and just balance out the shape.
What about length of a breast reduction? Like if you do a breast reduction, how long does that last? Do you need to keep doing them every so often?
Usually once is enough.
Oh, that's it?
Yeah, I mean, unless someone's going through a cycle where they're gaining weight, losing weight, stretching things out again. Usually once is enough.
Oh, that's not bad at all.
The exceptions would be people who are very, very young. Like if I have someone who just has a huge amount of breast development with puberty, and we intervene a little bit earlier because they just can't function, they're at a little higher risk at some point in their life of maybe needing another reduction.
I always wanted to ask, if you do a lift, there's like a little, is there a little table type area instead of putting an implant in? Is there something you can do underneath to give it some structure?
Sure, and the majority of the time we do reductions, we are not using an implant.
Oh, really?
Because that lower pole, we have good control over the shape.
Okay, so you can actually make it.
If someone has a little prominence up on top, then we don't have to worry so much about it.
I like that. Let's go to pictures. We got before and after pictures here. First one.
So here's someone with sort of that same sort of absence of fullness up top, a lot of fullness down at the bottom, and naturally the breasts tend to go to the side as they get larger. So what I've done is reduce not only the amount of breast tissue that's there, but the skin, and then also reduce the size of the areola or the nipple so that it now matches the smaller breast.
I like that.
So there is a scar that runs underneath the breast. There's usually a scar that runs from the nipple down in the middle, and then one around the areola, around that pigmented skin around the nipple.
And look at the second picture, you can barely see those scars. It's really
barely see the scars, and her pain was much better. And her clothes fit better. This is a side view of someone also, and you can see drastic movement of nipple position.
Big time.
From really pointing south to out in front, where we want it to be.
Implant in that one or no?
No. No, she had good, strong breast tissue, fibrous tissue, a little bit firmer, helps me get the position where I want it. And also the upper pole of her breast, she's got the rib shape that helps too. The ribs tend to come out a little bit.
God, that's pretty weird. It really does look like you put an implant in that one, but not
It
at all.
does. And a lot of times it will look that way for the first few months to a year, and then as gravity
then it
takes over,
relaxes
it
a little
settles
bit.
down. Yeah.
All right, we got lots more coming up. So if you want more information about Dr. Mele, just give him a call at 925-943-6353. Check him out on the web, drmele.com, sanfranciscobreast.com. We will be right back talking about breast reductions for men on Body Beautiful.